Welcome to the CanMed Coffee Talk podcast, where we talk with the leading minds in cannabis science, medicine, cultivation, and safety testing. I am your host, Ben Amaralt. I'm the marketing manager at Medicinal Genomics and proud member of the team that puts on the CanMed conference. Can you believe we are just about 30 days away from CanMed 23? We are really excited about this event and we have a lot of great things planned. So if you haven't gotten your ticket yet, do so now. We have limited capacity at the venue this year and you don't want to miss out. CanMed 23 will take place over 3 days, starting Monday, May 15th, when we'll be holding 4 immersive professional development workshops, including our full-day medical practicum, a cultivation workshop focused on plant pathogens, a capital markets workshop focused on funding cannabinoid innovation, and a newly designed lab compliance testing workshop that's all about potency inflation. Tuesday the 16th and Wednesday the 17th will feature oral presentations that were curated by the CanMed Advisory Board that cover topics like hop-latent viroid, the medicinal value of minor cannabinoids and flavonoids, delta-8 THC, and much more. We also have 2 amazing beach dinners planned. On May 15th, the dinner will include a tribute to Professor Raphael Mechoulam, who sadly passed away last month. The meal will include remarks from Professor Lemire Hannes, Dedi Miri, and Brendan McKernan, the Medicinal Genomics CEO. Attendees will have the opportunity to commemorate Professor Mechoulam during the special program planned for the evening. Professor Hannes will also be presenting at the May 16th dinner as well on the topic of how cannabis became a medicine. As you can see, we have packed a lot of excellent content into this 3-day summit, and I haven't even mentioned the world-class accommodations and amenities that attendees can enjoy at the Marriott Marco Island Beach Resort. All the information is at canmedevents.com. Go there today, and I hope to see you in Florida. My guest this episode is Dr. Bonni Goldstein. Bonni is one of the country's most respected and experienced medical cannabis physicians, having treated thousands of patients with medical cannabis. She is the owner and medical director of Canna-Centers Wellness Education. She is the clinical advisor to Cannformatics, and she is the author of the book titled Cannabis is Medicine: How Medical Cannabis and CBD Are Healing Everything from Anxiety to Chronic Pain. At CanMed 23, Bonni is leading the medical practicum and also presenting about minor cannabinoids during the main session. During this episode, we dive into one of those cannabinoids, CBG, also known as Cannabigerol. We discuss the following: what makes CBG one of Bonni's favorite new cannabinoids? What makes CBG a bridge cannabinoid between THC and CBD? The difference between CBGA and CBG? How CBG enhances the body's natural endocannabinoid system? How CBG works in combination with other cannabinoids? Conditions for which CBG is a good fit? Potential adverse reactions to CBG? And Bonni also provides a preview of the CanMed Medical Practicum. Before we get to my conversation with Bonni, I'd like to thank this episode's sponsor, the Dent Institute. With more than 300,000 patient visits per year, the Dent Neurologic Institute ranks among the largest neuroscience centers in North America. Its 24 subspecialty clinics often treat the most challenging neurologic conditions, including, but not limited to, migraines, chronic pain, ALS, MS, Parkinson's, dementia, and neuro-oncology. With their mission of advancing neuroscience, they established a cannabis clinic in 2016 to aid in the treatment of those conditions seen throughout the institute. For more information, check out dentinstitute.com. Okay, and without any further ado, please enjoy my conversation with Dr. Bonni Goldstein. Good morning, Bonni. Thanks for joining us on the podcast.
Thanks so much for having me again.
Yeah, no, I'm very excited to talk to you and have you back on the podcast for the third time, which makes you the leader in CanMed Coffee Talk podcast appearances. So, congratulations.
Oh, thank you.
And I think you may also hold the title for CanMed appearances too, but I'll have to research and get back to you on that. But in any case, you're presenting yet again at CanMed 23 about minor cannabinoids. So I wanted to discuss just one of those compounds with you that you're going to be covering on the talk. And so we chose Cannabigerol or CBG. And I watched a YouTube video you made about CBG in preparation for the talk. And at the time when you recorded it, you said it was one of your favorite cannabinoids. So my first question is, why is CBG one of your favorites?
Well, it appears to do a lot of things that THC does and a lot of things that CBD does, but maybe a little bit better, kind of the bridge between the two. It
Interesting.
is not intoxicating or impairing. It appears that lower doses can be taken for when compared to CBD. It does appear to address some of the main issues that people turn to cannabis for, which is anti-inflammatory, pain relief, anti-anxiety, even some sleep benefits have been reported, antidepressant, also anti-cancer. So like it checks all the boxes, and maybe lower doses and that non-impairing part will make it more acceptable to people who either don't like that or don't want to have the impairing part, but also don't have the ability to pay for very high doses of CBD.
Mm. No, and that's interesting. You say it's a bridge between THC and CBD because it is a precursor for those molecules, correct?
Well, that's right. So its parent compound CBGA is
Mm.
kind of known as the mother to all the cannabinoids, in that it is the compound that's found in the immature, cannabis flower that then, based on the genetics and of the plant and the enzymes that it's exposed to, does change to CBDA, which then turns to CBD with heat, and THCA, which then turns to THC with heat. CBGA hasn't really been studied very much. I would say it is highly understudied, and I bet that we will find out that there are some very interesting anti-inflammatory, probably anti-cancer properties. We don't know yet fully, but at least CBG is being studied. I mean, I constantly look at the literature, and just this year, in 2023, there's already a study published from Israel on how CBG may be helpful for multiple sclerosis. And then there's another study that looked at CBG on how the mechanism of action works for pain and inflammation. So there's a lot of interest in it, which is really exciting.
Yeah, that is exciting. And yeah, when I was watching that YouTube video, there was a lot of different research that you went through, and I'll put a link in the show description so people can check that out. So, with so much promise for a lot of different things, for what conditions do you think CBG maybe has the most promise? Or are you most interested in?
So I think again, going back to what I mentioned previously, I think for people who struggle with inflammation, pain, mood, like sleep, I'm sorry, like anxiety or depression, CBG holds a lot of promise. Ethan Russo did a survey along with some other researchers, and they published their results, and they found that CBG, and again, this is just a survey of people using CBG. It's one of the first reports out there on what are people finding. And it was highly rated for anxiety, pain, depression, and sleep. And I don't know that it's a direct sleep agent, but when you are having less anxiety and less pain, you likely will fall asleep a little bit easier and maybe sleep better. It was highly rated by people. Over like 70% of people said it was superior to their conventional medication. That's a pretty high number, right? And that shows a lot of promise for this. And again, in the research, they have found, and this goes back a number of years, they found that CBG did have anti-anxiety properties in mice, antidepressant properties, also anti-inflammatory, pain-relieving properties. So this is not something that people are making up. There is some evidence to support that in the preclinical research.
Excellent. And so that survey that you mentioned, is that CBG being taken by itself, or is it in combination with other cannabinoids?
It's a great question. I think in the survey, they tried to sort that out, and it was people taking plant CBG, that they buy in the kind of hemp market, because most CBG products that are on the market do not contain a significant amount of THC. They are coming from hemp plants. And so they are readily available on the hemp market. I've seen it as flower, I've seen it as topical. And that's another point, is that for topical, it has antibacterial effects, and it also has like what we call psoriatic effects. So psoriasis is a well-known condition where people get not only joint pain, but they get skin like these plaques and scales on their skin. It can really be very difficult condition. And CBG has has been found to have these anti-psoriatic properties, in that it decreases the buildup of those scales. It acts on the skin cells themselves, and it inhibits the proliferation of those scaly skin cells, which is really interesting. Again, I think this just goes to show the applications of cannabinoids is very widespread, right? And people always say, well, how is it possible that these compounds can do so many things? But they have multiple targets in the brain and body, and that's what makes them so amazing, is that and remember, the pharmaceutical model is this medicine addresses this specific target, whereas cannabinoids are what we call promiscuous. They kind of go to a lot of targets.
Yeah, no, and that's a good point. And that kind of brings up one of my next questions is, how does CBG differ in its targets than other cannabinoids? Are they working on the same receptors and kind of the same mechanisms of action as the other cannabinoids?
So there's some overlap with some of the other actions of, let's say, THC and CBD, but then there's also some like opposite reactions. So like CBD and CBG have opposite reactions at a specific serotonin receptor, the 5-HT1A, where CBD binds to it and CBG blocks it, right? And so again, they both act at that receptor, but differently.
Sure.
They also, CBG also like overlaps with CBD in terms of binding to what we call PPAR receptors, also at these what we call TRP channels, to help with inflammation and pain. One interesting thing about CBG is it so far is the only cannabinoid that has been found to work at the alpha adrenergic receptor, which is a receptor well known. There's actually pharmaceuticals that target that receptor. But importance for me is that when you address that receptor, you're addressing pain, inflammation, and even, that's a target for some of the medications for ADHD or for behavior issues. And so I have used CBG in some of my patients with autism. And some families, and again, you have to remember that we're all very similar, but we're different in the way we respond to compounds that we put in our body. I'm sure people who can take a particular medication, and other people, if they take it, they flip out, right? There's some people think it's the best thing ever, and other people say, I can't take that at all. I took one dose and I'll never take it again. We have such a wide, what's the word I'm looking for? Like, I guess, very varied way that we respond to medication. So again, when I try it in patients, like just this morning, I got an email from a family who said CBG made their child way too hyper. And that may be a dosing issue. So we're working on that. But in other families, they're reporting my child's calm, has better focus, even speech is improving in some of the children with autism who are nonverbal. So it's always a compound I consider when I'm treating, um, children who have either behavior or other types of difficulties. Why not try it? It's safe. We know that it's safe, and it's under medical supervision. And we start with very low doses so that we can control what's going on. And of course, there's a lot of oversight. The parents are watching, I'm watching, and we're just trying to make sure, of course, do no harm. But so far, I'd say about 60% of kids that try CBG seem to have some benefit from it.
No, and I'm glad you brought up ADHD because I guess full disclosure, my son has been diagnosed with ADHD. And when we first got that, I mean, of course, being in the industry and everything, I looked up like, oh, can cannabis help? And most of the things that I found was like, no, not really. It's kind of funny that, cannabis seems to help with everything. That was sort of one of the few things that I saw. But when I was doing research and I watched the video about CBG and you brought that up, I was surprised to see that CBG might be helpful for that.
Right. And again, we don't have clinical trials to say, yes, this is a definitive benefit for children or detriment. We just don't have the trials yet. And I do think that we're on the cusp of having those trials, which would be very exciting. So again, in my practice, which is in California, I'm allowed to work with parents to try different cannabinoids, right, to see what might help. And we do it very methodically. In my book, I talk about rule it in or rule it out. So we start low dose, we titrate up, we focus on that one compound to see what are the benefits. And remember, too, that sometimes when we're seeing a benefit, it may be because the child's also on CBD, and maybe for them that combination is working well. If you add a compound and see enhanced benefits, you don't know if it's that particular compound or the combination of the two, if they're already on something. So, it's a lot of trial and error, unfortunately. It's also, again, it takes time to sort it out. It's, I always tell patients or families when I first meet them, that we're going to be working together quite some time, because it's not like we just pick something and yep, it works great and see ya. We may get lucky and that happens, but that's not the usual case.
Yeah, absolutely. Another thing that stood out to me too was this idea of CBG kind of enhancing the body's endocannabinoid function. I was wondering if you could speak a bit to that.
Right. So a number of endocannabinoids, including CBD and CBG, block the breakdown of our endocannabinoids. So remember, our endocannabinoids are our inner cannabis-like compounds. Our body releases them on demand in response to a trigger, usually something that is stressing us, whether it be an illness. My famous saying is a bear chasing you in the woods, right? Just anything that might stress you, inflammation, illness, a traumatic insult, an infection of some sort. Your body cranks out these endocannabinoids in order to help maintain balance of the messages that the cells are sending. So you have to remember the endocannabinoid system is a physiologic regulator, and it's just helping you stay in balance. Anything that promotes the enhancement of endocannabinoids in general, now sometimes there are some detriments, but in general, especially in someone who's ill, that can be helpful. So by enhancing your own natural endocannabinoid system, by blocking the breakdown of these endocannabinoids, that means they last longer. Right? It's kind of like, the way that some antidepressants work is by blocking. It helps enhance how long serotonin's hanging around. Okay. And so these compounds do this, and it's very hard to measure. It's very hard to know if it's something that happens immediately. I don't think so. I think it's over time. What you see is you may notice, and I hear this a lot from adult patients. I don't think I need as much cannabis. I'm feeling pretty good. I'm not having as much anxiety. I'm sleeping better. And that tells me that maybe cannabis kind of augmented their natural endocannabinoid system, what we call upregulated. And they're kind of at a nice sweet spot where they're just a little more balanced. That's the whole concept behind, the idea of boosting the endocannabinoid system is to get yourself into better balance.
Right, right. And now, correct me if I'm wrong, but another way to sort of spurn your body into creating endocannabinoids, a stressor, is exercise, correct?
Yep.
So, a little experiment that I've been doing, and I want to get your your opinion on this, is after exercise, supplementing with whether it be CBD, CBG, would that be an effective way to sort of, keep anandamide in the system and get sort of the benefits from sort of our natural cannabinoids?
Well, theoretically, you could look at it that way. I don't know that physiologically that's exactly what's happening.
Hmm.
Meaning like, oh, I took a dose and now I have extra anandamide. I don't I don't think that there's a direct correlation there, but I do think, and I think the literature supports this whole idea of cannabinoids being anti-inflammatory, antioxidant, neuroprotective, and that one dose is not going to do the trick. It's usually a regimen that somebody, like a wellness regimen, if you're not
Hmm.
terribly ill, that includes cannabinoids, of course, in addition to other healthy things that you should be doing to enhance your endocannabinoid system, which, like, a healthy diet, good sleep, trying to really control your stress, which, is like a cycle. You use cannabis to control stress, and stress makes it so that maybe you don't need, if your stress is down, you don't need so much cannabis, but there's a cycle there that can be very beneficial. Um, yeah, I mean, I certainly don't think that it's, um, if I had to choose to give cannabis after exercise or not, I would say, sure, why not?
Hmm.
It certainly could be helpful in recovery.
Excellent. All right, I'll keep up my regiment then. So you also mentioned so that there is some overlap with CBG and other cannabinoids, and there's certain receptors or certain mechanisms that are unique to it. So I was wondering if you could speak to some examples where CBG sort of enhances the effects of other cannabinoids, or situations where you think the combination is useful.
Right. Well, and in looking at the study, so there's a study in 2019 that showed that the combination of CBD and CBG decreased neuroinflammation. This is an animal study, but they were looking at neurodegenerative disorders with dementia, what we call Lou Gehrig's disease or ALS. And it showed in this preclinical study that CBD and CBG worked together and gave better results for anti-neuroinflammation. And of course, remember, this goes back to the concept of the entourage effect,
Hmm.
which is when the combinations of cannabinoids and terpenes appear to enhance the benefits, enhance the uh, positive results. And there's another study, I know, I can't remember what year it came out recently, that showed that CBG, in addition to um, THC and or CBD, was anti-cancer in a model of, or in test tube study looking at certain brain tumor cells. So, in some of my cancer patients, who come to me with advanced cancer, very poor prognosis, I've been doing this now for a number of years. I add in CBG to the
Hmm.
mix. There is, to me, no harm in doing so. It doesn't cause, again, the impairment that anti-cancer doses of THC can sometimes um, do.
Yeah, and so I was going to ask you about that. So you just mentioned one, but what other scenarios or situations do you encounter where you think CBG is either the right tool for the job or might be a good kind of companion, or if you're already started a regimen and maybe things you're not getting the right results, you're thinking, oh, CBG might be helpful here.
Right, that's a great question, because I think that if you're trying to treat anxiety, pain, inflammation, and you are not getting great results with either THC or CBD, which of course are the two most common cannabinoids being used right now, certainly the addition of CBG is worth a try. Remember too that when you combine cannabinoids, sometimes you can get away with a lower dose of either or of both, and get that enhanced effect from that entourage. Because there are studies that show that subtherapeutic doses, meaning doses not expected to do anything clinically, right? But when combined, will work better. And so I have had patients who say, rather than take, let's say, 300 milligrams of CBD for my anxiety, which people might like look at that and say, wow, that's a really high dose. But when you look at the studies, those are the doses that are being used in studies to get a true effect, right? To be able to find a true effect. And remember too, there's some placebo effect. If I'm taking CBD and it's supposed to decrease, let's say, my pain and anxiety, I may have less pain and anxiety because I'm actively doing something about it. And I don't poo-poo that. I just say, for a lot of people, high doses, it just is not financially feasible.
Right.
So sometimes that combination of two compounds in more what we consider subtherapeutic doses, but in that combination will work better. So again, the things that I would recommend CBG for: anxiety, pain, psoriasis. I use it in my patients with autism. I use it in my patients with cancer. And certainly, I think the future, so this study that came out this year on multiple sclerosis, is that something now we should be trying in our patients, right? And remember, that's an animal study. Mm-hmm. So we're taking a leap, but again, because it's safe, if somebody's struggling and conventional medicine is not helping them, or it is only helping them to a point, I don't see any reason, especially under medical supervision, not to try cannabinoids, and specifically CBG, now that there's some research to support it.
Yeah, no, and that's a good point to make. It seems like CBG is very well tolerated by patients, but are there adverse reactions that you typically run into?
So I haven't really seen a lot of adverse reactions, except for a few kind of specific ones related to the population of children that I take care of. So in some kids with autism, it's just too overstimulating. Mm-hmm. It makes behavior go off the charts. And I have seen that numerous times. And so I do warn the families, we're going to get started. It may be a dose thing, that lower doses might be overstimulating. And then we try higher doses, which sometimes can be more calming. But that's specifically related to that population. I have not heard of too many side effects from adults taking CBG, except for a few things. So I have had some patients say that it is somewhat alerting, meaning it feels a little up. So you would not want to take that right before bedtime. Yeah. It would just be you figure out how you respond to it, and then don't use it at night if that's the effect you get. Again, on the other hand, some people say it helps with sleep. Well, maybe it's helping with sleep because it's more calming and decreasing anxiety. And again, your response, when you, let's say 10 people get a similar response and you're the outlier, and you say, well, what's wrong with me, right? You just have a different chemistry. We all just have, I don't get to get like somebody's underlying chemistry report before I treat them. Right. So it is, but nobody does. When a doctor hands you an antidepressant or an opioid, nobody knows how you're going to respond if you've not taken that before. It's the same thing. There's always a little bit of a risk when you take a new medication that you may be the person who doesn't respond very well. But on the other hand, you might be the person who gets a great result. So I do think that in that report by Dr. Russo, I think there were some reports of dry mouth or some reports of feeling high or whatnot. And again, it goes back to what was in the product that they were taking. They did not report on the exact products that patients were using. So it's always a matter of, well, what else is in there? And also dosing. Dosing is very, very important. You can't just take some and think it's going to work. You should know what you're doing when you're dosing it out in terms of milligrams.
Yeah, no, and that's a good point about the different products too. And I was going to ask you, so, CBG, it's one of the lesser known cannabinoids, but are there a fair amount of products available out there for folks to get?
That's right. In the video that I put up on YouTube, I do have a slide that shows some of the products. You can get it as flower. If you wanted to vaporize it, you can get it as a topical, as I've mentioned. Mostly I've seen it in tincture form, which means, an extract in a bottle where you have a little eyedropper or a syringe and you measure out your dose and squirt it under your tongue. I don't endorse any company, so I can't point anybody in any direction, but certainly a quick Google search, I'm sure you can find it. And of course, always, 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 before purchasing anything, you want to make sure that you get what's called the certificate of analysis and you see that what is truly in that bottle before you make a purchase. And if the certificate of analysis isn't available or not readily transparent, it is, move on to the next product.
Yeah, absolutely. We actually did a podcast with a laboratory professional who was talking about how some manufacturers will even falsify their COAs, and she had some good tips in there for being able to spot the real ones and maybe the less scrupulous ones. So I'll put a link to that one in the show description too, because I think it's a good thing for people to know. All right. So, Bonni, before I let you go, first, thank you so much for talking about CBG with us, and look forward to hearing about the other cannabinoids in your talk at CanMed. But I also wanted to bring up that you're also going to be leading our medical practicum at CanMed 23, along with Dustin Sulak, Kevin Spillman, and Eloise Thiessen. So I was wondering if you could give us a kind of a quick preview of that, of like what people can expect at the practicum, and why do you believe it's so important to have events like this to educate clinicians and laypersons about cannabis medicine?
Well, I'll answer the last question first. So the importance is that for healthcare professionals, there is no full bore training program. There is no residency or internship. We now do have some schools are offering master's degrees and so on. But I think hearing from clinicians who are actually practicing this medicine, this type of specialty, and working with these medicines and really learning the nuances of them is very helpful. And that's the feedback we've gotten in the past, is having a kind of mentor clinician educate is really helpful to build on the foundation of what you might be reading in the literature or in a book, so to speak. And for the practicum, it's a full day of education. So we start off with, endocannabinoid system physiology, the physiology of the cannabinoids and the other phytoconstituents of the plant. And I just want to note Dr. Spellman, Kevin Spellman, who's a brilliant, botanist, herbalist, years and years and years of experience, and his lecture is amazing. Opens your eyes, especially coming from my background, which is as an MD in the allopathic world. It was a big change for me to understand botanical medicine, and so having him on board really helps bridge that gap for those of us who are coming from the allopathic field. And so we also go through special consideration, clinical applications of cannabis and special considerations for geriatric patients. We have a talk on chronic pain treatment. I'm talking about pediatrics, and then we have practical panels where we're going to be giving case reports and, how to help your patients pick medicine. And I mean, it's just a day chock full of information for really anybody who wants to advance their knowledge.
Yeah, no, it's a fantastic event, usually the highlight of the event. And no, I think you're right. I think it's the collaboration that I think is really great too, because you guys get a lot of great questions from the clinicians who are in the audience, who are, again, sharing some of their experiences, and to see you guys sort of go back and forth and share that knowledge. It's really fascinating.
Yeah, I really enjoy it. It's great to be around like-minded people, and it's great to hear about other people's experiences. I always learn something from my colleagues, from people in the audience, from the other speakers. It's just, for me, it's, I walk away from CanMed every year saying, wow, that was great. So I hope other people find it to be great as well.
Absolutely. All right, Bonni, again, before I let you go, I know I already said that, but one more thing. If you would like to plug website, social media, anything, so folks can learn more about you or get in touch with you, please share away.
Okay, so I have my YouTube channel, which you mentioned. It's Bonni Goldstein, MD. Remember, there's no E at the end of Bonni. And then I do have an Instagram, Bonni Goldstein, MD, as well, where I do try to remember to post. I don't post very often, but I try. And other than that, I really don't have Twitter and all that kind of stuff. I am on LinkedIn in case anybody wants to connect with me through there.
That's all right. Don't worry about your social media. You're plenty busy as is, Bonni. But thank you again for taking the time to talk with me today, and can't wait to see you down in Florida.
I know it'll be really fun. Look forward to seeing you.
All right. I hope you enjoyed my conversation with Dr. Bonni Goldstein. Check out the links in the show description to learn more about the topics we discussed. And thanks again to this episode's sponsor, the Dent Institute. Our next episode drops April 26th. That's 2 weeks from today. In the meantime, don't forget to check out the CanMed 23 schedule at cannabinoids.com. I think you will find that not only does our lineup include some of the biggest names in the industry, but they are also addressing some of the most important topics, such as hop-latent viroid and other plant pathogens, the efficacy of minor cannabinoids and compounds, Delta-8 THC, lab shopping, and more. You don't want to miss out on this opportunity to learn from and network with the leading minds in the industry at a world-class resort. It's going to be an amazing event, and I hope to see you there. But of course, if you can't join us, we hope that you'll continue to listen to the podcast, follow us on social media, and check out our CanMed archive at cannabevents.com. All right, that's it from us. Stay safe, stay healthy, and please do come back for the next CanMed Coffee Talk.